Back then, in 1999, the popular slogan amongst my high school friends was, "Anyhow, US down," which translates to, "Somehow, let's go to the US." There were boys who had towels bearing the US flag, and there were girls who used to pray, complete with a gesture, whenever they used to cross by the US embassy. I was the black sheep, you see. I was somehow unaffected by the US fervor and decided to stay back and study medicine. Fast forward 2 decades later, I am now an associate professor in one of the medical colleges here in Kathmandu. And I find the same zeal of going abroad amongst my medical students. Every year, I write at least 15 letters of recommendation for my medical aspirants who want to go abroad for their further studies. And this is just for one subject, pediatrics. If you combine all the other major subjects of medicine, you will easily get 90 to 100 students applying to go abroad. That is an entire batch of doctors from one single medical college. Let us now see what attracts these young doctors to want to go outside. They see this big, shiny, bright future calling out to them. They have a promise that they will get a scholarship for their further education, and they get paid a good stipend while studying during their residency. They have a good pay once they are employed. They have a better lifestyle, financial security, a better house, a better car, a better everything. But it's not just that. There are a lot of factors in our country which makes them want to go, the push factors. Do you know an early career young doctor who has just passed out earns less than a laborer in Kathmandu? After his regular job, he has to run from clinic to clinic just to make a decent living, which gives the general public the impression that doctors are always busy, running around, and lobby, greedy. But he does this to make a decent living because his regular job does not pay him enough. And perhaps he has, or his parents, has a loan which he had taken out to study medicine, which usually runs in lakhs. There are other factors. You must have heard the recent incidents. There's a lot of aggression, violence towards doctors, and the tolerance of the general public is very low. They easily blame the doctors for negligence and sometimes even being the cause of causing the death of the patient. So unemployment, lack of regulation and monitoring, and political encroachment of the health sector are just a handful of reasons why someone would want to leave the country. Developed nations, they rely heavily on a constant supply of doctors from the developing world, like Nigeria, Sri Lanka, India, and Nepal, to man their health force. What does that leave us with? Their health system is going from strength to strength. But ours, we have a scarcity of doctors, especially in the rural areas. There's a lack of qualified good doctors. There's a published report by the International Labour Organization in 2017, which states that the ratio of individuals and doctors is really low in Nepal. So the recommended ratio, according to the World Health Organization, is 2.3 doctors and nurses per 1,000 individuals, whereas we in Nepal have just 0.67. So you can see the gap. And those who want to leave the country, once they reach their favorite destination, the foreign country, wherever they want to be, it may not be all rosy and pink once they land there. They will always be an outsider, struggling to fit in, trying to get the right accent, and a local native will always be their boss, and he has to work extra hard just to prove himself. There are advantages, there are perks of staying back in your own country. Do you know that your chances of securing a research grant or a scholarship or a travel grant is much higher if you reside in a low middle income country? You will always be surrounded by your loved ones and family. You will have a tight social network here in Nepal. You will always get to talk your favorite Nepali slangs and language. This is especially convenient when you are unwell or when you have young children. And of course, you'll always get to eat dal bhat twice a day. So, developed nations, they are really relying on us to give a steady supply of doctors. But here in Nepal, we have a crucial need of the hour to have a framework, guideline, and an act so that we do not encourage our doctors to go outside of the country. There should be financial and non-financial incentives so that they don't want to leave. They feel good, happy about their job. There should be job opportunities so that they can have further development in what they want to do, the specialty they want to choose. And there should a gap between an institution producing health workers and the one employing them, there's a huge gap. So that gap also needs to be addressed. And there should be a law in place so that doctors are protected from the aggression and violence towards them from the public. As a financially independent mother of 2 precious children, I sometimes find myself foolishly wondering, what if a young me was easily influenced by the anyhow US now slogan? One thing is for sure, I would have definitely pursued my dream of becoming a doctor. But perhaps this day, I would be a pediatrician in the US, having to leave my toddler son in daycare instead of his mama ghar. I would be a pediatrician without any domestic help, doing my own dishes and laundry. I would be driving my daughter in a car seat to a ballet recital. And I would be thousands of miles away from my crazy, party-loving, food-loving Newari family. So those who have left, they may be financially secure and may have a better lifestyle, but they are the ones who will make their dead parents wait in a freezer to reach their flight for their final rites. They may have a better education for their children, but they will be constantly worrying about random school shootings, drug abuse, and their mental health. They may have the security of health insurance, but whenever an unforeseen condition arises, like suppose you give birth to a preterm baby who has to be in the neonatal intensive care unit for a month, after the coverage of health insurance, your bill will still run in 60 to 70 lakhs, and you will spend half your life trying to repay that debt. You may not have to worry about basic needs like water and electricity, but your heart will always long for a piping hot plate of momo or jeri swari. The decision of a young doctor wanting to leave the country is multidimensional. There are a lot of push and pull factors, political, social, economical. I stand here in front of you not because I could not leave the country, but because I chose not to. Like me, a simple idea in a doctor's mind, not wanting to leave the country, could make a difference and an impact on the quality of healthcare you and your family will get in your next doctor visit. Thank you.